Hi everybody. I'm a couple minutes early here, but I was ready, so here I am. Okay, so for anyone who doesn't know who I am or it's your first time here, my name is Amanda Pratt. I'm a licensed clinical social worker with Imagine Life Therapy, and I'm based out of St. Petersburg, Florida. My practice specializes in working with people who live with chronic illness, sometimes multiple chronic illnesses, and the focus is helping them manage their symptoms and manage their illness and all the things, the ways that that illness affects their life. So that is me, and that's why I'm here. Today, we're going to be talking about a few things. One, we're going to be talking about my most recent blog post, which also is something that I spoke about at a local lupus support group that I belong to last weekend. And so the blog post goes along with that. It kind of expands on it a little bit, and I'm going to expand on it even more today. So if you missed the lupus support group this weekend, you can get the information here. If you were there, you still might learn something new today. So that is awesome. And then I'm also going to go over the free worksheet that comes with that blog post. And the link is in the description for this video. And then also I'm going to give you 2 lupus support groups and the information for that that happen in our area, in the Tampa area. So if you are a person living with lupus like myself, you can reach out to them and you can PM me, and I'll give you the contact information for the person who is in charge of that support group so that you can get the information and hopefully attend. The support groups are a really great way to build a sense of community, to be around people who are probably going through some of the same things that you're going through, and I have found it very useful, so I'm sure you will too. Okay, so getting started, we're talking today about 5 ways that you can manage difficult symptoms, and I talk specifically about lupus, but this really could apply to any chronic illness. So when I talk about coping, what coping is just our response to some kind of stressor we're having, and it could be a physical stressor, it could be an emotional stressor, it could be a psychological stressor, but our response, whatever way we respond to that stressor, is our coping style or our coping strategy or whatever. Sometimes they're positive and sometimes they're negative. So really the ideal is to have positive, healthy, and effective coping responses to stressors. And the ultimate goal is to accomplish something by responding in that way that reduces that stressor. So we use coping skills whether we realize it or not, and so we're going to go over 5 positive ways and helpful ways to cope with symptoms, and then I'm going to go over the worksheet and tell you how to use that and what you're looking for in that worksheet. And the worksheet is downloadable again on the blog post, so if you want to, you can go download it now and follow along, or you can do it afterwards. But please let me know if you have any questions about how to use it or any feedback. Okay, so the first coping style, I guess you could call it, the first coping skill, coping response, is to recognize the problem and where the problem is. So obviously we need to identify where the problem is. This is where the worksheet comes in handy. So the worksheet that I created, it's called the Coping Analysis Activity, and it looks like this. And there's 3 boxes. The first box is where you're gonna write your stressor. So it could be anything that stresses you out. It could be a symptom that you experience. One stressor could be finances. One stressor could be maybe the job that you're at. One stressor could be maybe you don't get enough sleep. One stressor could be maybe you don't eat appropriately, or maybe when the pain you're in gets really intense, then that is difficult for you to handle. That's a stressor. So you're going to write those things, list them in the first column, okay? The second column is your coping style. So here it gets a little tricky because most people will want to put like, what is the right way I know that I should deal with this? But you want to be honest with yourself and write down how you actually respond. So for example, if your stressor is finances and you know the ideal is that you should probably, pay your bills a certain day of the month or whatever, but really the way that you respond, the way that you behave to this stressor every month is that you wait until the day they're due and then you freak out because you haven't paid them yet and they're due today, and then that's your coping. That's how you cope. That's your response. You're going to write that in this box. Then you're going to rate how effective is that. Do you feel like it's effective? Does it get you where you need to be? Does it reduce stress for you? Does it solve the problem when it comes up quickly? You're going to rate that on a scale of 1 to 5, 5 being very effective and 1 being not very effective. And so the goal here is to list all your stressors that you can think of, list how you respond to them, and then rate how effective they are in solving your problem. And if you notice any of these are below 4 or 5, then there's some room for improvement there. And that is where you want to start recognizing where there might be a problem in your coping that you can improve upon. So that is the goal for the worksheet. So you can do that at home. And we're going to go through some ways now, after you've identified what your problems are or where there's a problem, ways that you can help reduce that stressor. So one, obviously, is to reduce your stress. Now, if you have lupus specifically, or really any autoimmune illness, you know that stress is a huge factor in how you feel. And stress is a very tricky thing. We all experience stress every day, and there's a healthy level of stress that we want to experience because it's actually good for us. However, our bodies, if you have an autoimmune disease, are very sensitive to any time that stress kind of goes above where it should be, and so we need to manage that. The way that we manage our stress is by identifying the stressors and looking at how we respond to it and adjusting how we respond. We also want to look at those stressors and say, is there any of these that I can eliminate in my life? So for example, if you are working a job that is very, very stressful, maybe you want to sit down and think about making the tough decision to leave that job and start somewhere else that's less stressful. Maybe the amount of hours you work is what's causing you stress, and maybe there's a way that you can reduce that so that you balance your stress better. So in therapy with my clients, sometimes we take a look at these things and we have to make hard decisions, and they decide to do one thing or another, whatever is best for them, whatever they're comfortable trying. Sometimes you make baby steps and you set goals for yourself and you reduce your stress in small, manageable chunks. But anytime you can reduce your stress, it's going to be so much better for management of your illness and your symptoms. So that is number 1. The other way you can reduce stress is by increasing your self-care activities. So if you can't reduce the stressors because they're things that you have to have in your life, then if you can't reduce your stress, then you have to increase your self-care activities. So these are activities that are automatically stress reduction activities. Things like exercising, eating healthy, maybe doing meditation or breathing exercises every week. You want to increase those. And what I tell my clients is that if you think of your life and your body like a scale, if your stress goes up, then you need to balance that by increasing your self-care activities, or else this is going to have way more of an impact on you. So we have to really keep an eye on that. Okay, so the next one is clean up your mind, or what I like to call getting your mind right. This is a very tricky subject for people with chronic illness. Some people like to call it positive thinking, and it's overused, but it's kind of essentially what it is. But what we're talking about specifically is restructuring your thoughts. So this up here has a lot of control over us. And if we are thinking in negative thought patterns, and patterns meaning over a long period of time, you have patterns of thoughts that come up when you get stressed or when something negative happens. You might automatically think certain thoughts that bring you down. They can depress you, they can cause you to be more anxious. And also we can have thoughts that are irrational. So one example of an irrational thought is what I like to call shoulding on yourself. So we like to tell ourselves what we should or shouldn't be doing, and it gives us this stress or expectation that what we're doing isn't good enough, and so that is irrational. So what we need to do is stop shoulding on ourselves, and that's what I tell my clients. Don't should on yourself, because really we're doing the best we can all the time, and if we try to stay in the moment and focus on the process and not the outcome, then it's going to reduce the stress on you, and that leads to more rational thinking. So another irrational type of thinking, or thought trap I like to call them, and I'll do a whole nother talk about that, but another thought trap is fortune telling. A lot of times we like to imagine in our minds how a situation is going to play out, and then we assume that that's real life. But it's irrational, because we can never know how something's going to happen in real life, and things never turn out the way we expect. So this is what I mean by kind of cleaning up your mind. We want to restructure thoughts that are irrational, negative, or unhelpful, and we want to focus on thoughts that are helpful, rational, and uplifting, supportive, keep us in a good mood. So we know that if you're in a symptom cycle, which anyone with lupus knows that when you get in a symptom cycle, it spirals down very quickly. And if you have negative thoughts that automatically pop up, it can lead to depression that is very hard to come out of. And I know, because I've been there. I speak from experience. And I do this too. I have to sit and use self-talk and rationalize and tell myself, okay, you're in a thought trap right now, stop doing that to yourself, you know. And it takes practice, but it's doable. The next coping thing that we want to do is give your body something to do. So movement is very powerful. I saw Mel Robbins speak a couple years ago about her book called The 5-Second Rule. And you should really read it if you like reading, if you are looking for something to read. It's a good one. And she talks about this very simple concept about how, you know, when you get caught up in that stuff, if you move your body, if you act, take a step within that first 5 seconds, it changes everything. And so that goes with any kind of body movement. If you are kind of stuck in a negative spiral, or you're feeling depressed or anxious, or you're experiencing a symptom that is really difficult, like fatigue or pain, give your body something to do. If you're bedridden and you can't get out of bed, which sometimes happens, you can do some movement while you're sitting there. Movement with your hands. You can draw. I like to do adult coloring. I have a coloring book next to my bed, and whenever I'm flaring really bad and I can't be out of bed, I will color, or I might do something on my phone that requires activity. Sometimes I like to listen to audiobooks and stuff like that. Even movements around your house that you typically do, like cleaning, going and taking a walk around your house, even if you can't take a long walk. Small short walk and then go sit back down. Just a small movement is really powerful and helpful. So that is a good coping skill, and it gives you a little bit of exercise, and as we all know, exercise reduces stress. So the last one, and this one is often the toughest for people, but is very important. And this is the support system overhaul, is what I call it. This is where you have to take a good hard look at who is in your life and who you're surrounded by, because we know we're only as good as the people we're surrounded by. This could be your family, this could be your friends, this could be professional colleagues that you associate with often or daily. If these people are not supportive of you, if they are negative in any way, sometimes when you get a chronic illness, people are doubtful or they're not very validating or patient with us, that can actually perpetuate symptoms and cause stress on us. And that is not good for anybody. So eventually we learn that we have to be selective about who we surround ourselves with, because if we're not, then they can really drag us down. And if we're stuck in a negative thought pattern or we're having irrational thoughts, their actions and speech and communication to us can actually perpetuate those thoughts we're having, so we believe them more. We think they're rational, but they're not. So it's good to reevaluate your support system, and sometimes you can ask others for feedback that you trust. You know, do you think this person is good for me? And hopefully they'll give you good feedback. And we talk about that usually in therapy as well. And that's a tough decision to make sometimes, but we can like people from a distance and not necessarily have them in our lives every day if they're not good for us, and still care about them as people. But our health is number one, our self-care is number one, and that has to come first. And that's definitely an area where I encourage people to be a little selfish. So, all right, so that's all 5. There's so many more ways that we can cope. There's so many more coping skills that we can learn, but these are kind of the biggest 5 that I go over with clients, or that come up with clients in therapy. And these coping skills, really, I'm talking about them in terms of chronic illness, but these are things that even if you don't have a chronic illness, if you just have any kind of difficulty, if you're having any kind of trouble in your life where you're in a downward spiral, these things can really help you cope with any kind of stressor in your life. So this is a good practice for just about anybody, anytime. And so hopefully there are other people who take something from that as well. So again, the link to this blog post that I'm talking about right now is in the description for this live video. And in the blog post, you can download this coping analysis activity, and you can do it yourself and kind of see where you're at and see where you might need some improvements. The other thing I want to talk about is the lupus support groups. Now, if you are in the Tampa area, or if you're in Florida anywhere and you're willing to drive once a month, and sometimes people are, to find a good support group, I have 2 support groups here. One is in Spring Hill, Florida, and one is in Tampa. I go to the one Tampa every month. I enjoy that one. So you might see me there if you decide to join us in Tampa. And I spoke last month, and you know, I might speak here and there on and off, giving people some new skills. So the Spring Hill group meets at IHOP on Commercial Way, and they meet on the 2nd Saturday of each month at 1 p.m. And the Tampa Lupus Support Group, we meet at Brunchies on Northdale Mabry, and we meet on the 3rd Saturday of each month at noon. And I can say that it's kind of nice to go once a month, and we have our own little private room, and we get to just have lunch with everybody and talk and catch up and see how everyone's symptoms are going, and kind of give each other advice about things maybe that work for us or don't work for us. But it's really great to be surrounded by people who are going through what you're going through, and that is a good way that you can bump up your support group for one of those coping skills. So if you need the information, the contact information for either of those 2 groups, please message me through this page, and I will be happy to share their information with you, and you can email them directly and touch base with them. So that's all I have for you today. Hopefully you got something out of it, and if not, this video is available to rewatch, and you can watch it later if that's more convenient for you. So, all right, thanks for joining me, and I hope you all have a great weekend, and I'll see you later. Bye.